Okay, good morning. Welcome back. Now we're moving to H218 or repicking up H218. And we are going to be meeting with Commissioner Levine to discuss these priorities. And as I mentioned earlier, later in the week, we're going to be hearing from other members of the settlement committee directly, just to hear their perspective on the recommendations. And of course, we have some questions and offering some observations of our own. So, Dr. Levine, welcome back. When you were here before, and we gave you a cake and everything.
I was going to say,
I don't have any cake for you this morning.
I did not expect such. I do thank everyone once again.
Well. We do have a presentation from Dr. Levine on our website. Are you going to share that on the screen? Is somebody going to be sharing that for you, or
we've sent it?
Who's running the screen for you? We don't normally do that.
Oh, we can coordinate that.
Okay.
Is somebody here?
Yes.
Jessica's here.
Jessica's here.
Do you have the link? I mean, already. Okay.
All right, so if you want to just
while she's pulling that up, Mark Levine, Commissioner of Health. I'm the non-voting chair of the Opioid Settlement Advisory Committee, which makes all of the recommendations for use of the so-called abatement fund.
And we just had about 40 minutes of overview of, because we had a lot of new members, about what that fund is, how it was created, the legislation, all that kind of stuff. So,
and I had a little testimony about process previously, which I won't reiterate. And I do believe there's congratulations in order, because we have a new member, because former Representative Whitman had to be replaced. Replaced by a member of this committee.
yes. Representative McGuire.
Thank you very much for the opportunity, sir.
Okay.
Won't have the advantage of the current non-voting chair to interact with on that. So,
Well, my goal to frustrate you as much as I frustrated the chair the last couple of days, so.
that stuff I know nothing about.
All right, Jessica.
Okay.
Looks like she's signing in there.
So, I guess by way of, we're still waiting for the slide. So by way of introduction, there's a variable amount of money each year that comes into the fund because there are a minimum of 7 settlements, and they all have different timings, different amounts, different payment schedules. It doesn't frustrate our work necessarily, because we still hear proposals, make decisions, et cetera, et cetera. But we always like to have a ballpark notion of what we have to spend each year before we get too excited. And this year we had a pretty good ballpark notion. The other issue, of course, is the new settlement. We have not yet got in our hands, but it will be the Sackler family one. And it's my understanding that that's going to be a one-time payment of $22 million. So that will make things a little curious in the next go-around, because I'm not sure the committee nor the legislature or governor would wish to spend $22 million all at once. The way the Sackler money was supposed to come prior to Supreme Court decisions was over 18 years, about $3 million per year over 18 years. So it doles it out, but that has advantages as well. This year, we had 12 million plus a little change that could be appropriated in fiscal year 2026. And comprising the percentage of that 12 million that we're going to talk about today is monies that the legislature in the previous session said should be done on an annual basis, so long as the fund could support that. And then in addition to that will be new monies that are proposals that have never been seen by this committee and will be today. So we'll go straight to now that the slides are up, thank you, Jessica. We'll go straight to the first slide. My intent in the first several slides is to go over those items which were deemed to be worthy enough to be repeated year after year after year. So last year, we funded almost to $2 million case management staff positions within our preferred provider network. And case management staff positions are really meant to find people that we don't know exist sometimes and can't find elsewhere. They're not in our treatment system. They're potentially living in shelters. They're potentially unhoused in other ways. They may be justice involved in some way and connected with us or what have you. But basically, we want people to find them so they can be connected to services that might be useful to them. So the first year's money went out to all of the preferred provider network, which is the substance use disorder treatment system, essentially. And everyone basically got that money to hire a person. You'll note in the newest proposals this year, there's going to be one proposal that has to do with finding yet an extra person for someone who's not in the preferred provider network system. But we'll get to that in a bit. So,
Ask a question.
we believe that money is all expended and ready to re-up, if you will. For the
Okay, so that, I mean, I guess that's the impetus for the question. So, from your department, it shows that 1.5 million has not been expended. Obligated, yes,
Right.
but not expended. And I'm just
Awarded in grants is, I guess, the way we
awarded in grants, okay?
think about it.
And you know, not knowing the specifics of the grants and how the drawdown happens for those grants. I guess the question is, would you expect all 1.976 of that to be drawn down in this fiscal year?
That's the hope, because we made grants to everyone who wanted one, and that left no money. That's why we have this new proposal in the next year for an additional position through VCJR, because we could not tell them they could use some of the money that already.
Okay, I guess the question is that, and I'm glad Nolan has joined us here. If there's 1.5 that has actually not gone out the door, you know, so I get that. We understand that everything in that middle column there, where it says unspent obligations, is obligated. We know that it's in a grant agreement out there someplace, and it is in the process of being drawn down some way. But we're also then looking at, you know, another 1.9 million for FY26. And I guess the question is, it feels like if we're 8 months into the fiscal year, it seems unlikely that all of that 1.5 would be drawn down this fiscal year.
Yeah, and I wish I could give you a firmer answer, because we believe it should be, since we've made grants for that. But
It's also, I would imagine it's also dependent upon hiring staff and the.
it is, and workforce is a huge issue.
Yeah,
But so many have, if we look at it as the glass half full, so many have actually found staff and
That's great.
hired them.
yeah.
So my hope would be that the rest could, but it is the biggest challenge in probably mental health and substance use is workforce, no question.
I mean, so, you know, one of the things that we're obviously going to be considering, like on the Overdose Prevention Center, we're probably not going to allocate another $1.1 million because they're not even close to even opening, okay?
We're on the same playing ground as you.
Okay, so I also, while we maintain the commitment for those staff, if there are going to be unexpended funds that are going to be able to be carried forward, it would reduce the request of 1.976 for 26.
I understand.
And we would need to know that amount.
Okay.
For, that's going to be the same question for all of these
Okay.
items.
So the answer to bring back to my team is, how much certainty is there in the grants that have not yet been expended being actually expended versus,
And, right, and if not,
and if not, will they be in the next year or not at all?
What?
Yeah,
what can be carried forward? So,
okay,
we don't have any
Yeah.
desire to reduce anything. We just
yeah,
don't,
yeah, no,
we
this
just
is,
don't feel like we need to necessarily reappropriate it if they're gonna have funds to carry forward.
completely with you.
Okay.
Yeah, this
That would be
is-
helpful if we could get that. That's an ASAP, unfortunately.
Yeah, no,
Yeah,
I understand.
Okay, thank you.
Yeah.
Yes, you can have that sent to Nolan and he will work with us and appropriations at the same time, so.
Now, as you foreshadowed, the next slide is the Overdose Prevention Center. And this is probably the only place where the letter to the committee coming from the Department of Health differed from the letter coming to the committee from the settlement committee itself, in that we both recommended this continue, but in my letter, it says essentially, haven't seen the money spent yet. In fact, we have not yet received an application for a grant from the city of Burlington. We've done what we needed to do in terms of the rule book
Mhm.
and the guidelines. And we understand this is not a process that can happen quickly for anybody. So we're still awaiting that. So knowing that we're still awaiting that, and like you pointed out, 8 months or the months are going by, it's unlikely they're going to need to sustain a facility that's already existing in the next year because it doesn't exist yet. So we're fine with it.
Do you?
It's wise use of resources.
Yeah, do you have any update on, I know.
No, but as recently as a couple of weeks ago, we had conversations and there's really no update.
Yeah, okay.
It's gonna, the mayor's original declaration was, we will have this up and running in a year. And she has backed off on that position a bit. Due to realities, I'm sure.
Okay, thank you.
The next is recovery residences that are certified by the Vermont Alliance for Recovery Residences. This funding as well has been awarded in grants. There were 2 new recovery residences that were established with the FY25 appropriation. They were Good Samaritan and Shires. Good Samaritan has opened already, and that was a total of 8 beds, which I shouldn't say that. I'm not sure how many beds, but it brought it to 104 beds statewide. The Shires is either going to be open within a week or 2 or sometime in the month of March, and that will be an additional 8 beds.
We have a question from Representative Garofano.
So if these have been opened, shouldn't there be some expenses associated with them? Because the information on the spreadsheet shows that it's been obligated, but 1.2 has not been,
Nothing has been
nothing's
drawn
been
down.
drawn down yet.
You find them on the spreadsheet.
About halfway down, bottom's half.
Oh, yeah.
He doesn't have a
It
color
doesn't have a
version.
color one.
Here,
No, but I see where it is.
okay.
Not a problem. Have to find out more.
Yeah,
All I know is that we have certainly gone through the process of awarding this money in grants. So it's a little unclear to me why there would not be any expenses.
so we don't need to ask that same question over and over
No.
again. So I think you've got the sense of, we really do need an update from your business office about what's gonna happen with these unspent obligations.
Okay,
Okay, thanks.
There is an additional feature on this one, though, that you need to understand.
Mhm.
The administration's understanding of the legislative intent, as it was stated last year, is to maintain funding levels that would be necessary to support the existing recovery residences, including the 2 new ones established. So the language about at least 2 new recovery residences was specific to FY25.
Yeah, I didn't mean 2 new ones each year.
Right.
Yes.
And so it may require a technical correction or what have you. That's just my observation, not recommendation necessarily.
Head nods from Ledge Council.
Yeah, good. And that's enough for that.
Okay.
The 4th item that's in the previous bucket, so to speak, has to do with syringe service programs. So the current status is $700,000 in funding to current providers has been awarded, which needs continuation as per the legislative intent. The geographical expansion was another feature of that, and that was the $350,000. And we did a request for proposal process, which closed on January 21st. And we received a total of 1 proposal, which was only for the amount of $50,000. And that's currently still under review. We'll probably renew the solicitation to implement the legislative intent of the appropriation. So it's uncertain if grants that grant awards totaling $350,000 for new programs are going to need, if they weren't used, certainly we need the $700,000 that was intended to keep these programs running, but the $350,000 may not be necessary.
I'm trying to recall, I remember somewhat the testimony in committee. I'm just looking to the seat because that's where Representative Small used to sit. And an expansion into Addison County, I think, was one of the key areas.
Yeah, well, that was certainly requested. I'm not sure if that was.
Well, we were talking about unserved areas, so,
Yes.
and I'm recalling that part of it may have been, or the expectation potentially was that existing providers might expand into unserved or underserved areas. And so, do you have any feedback about, potentially why there wasn't more response to the RFP?
My only observation and knowledge is that much of what happens outside of Chittenden County is mobile, as opposed to bricks and mortar.
Mm-hmm.
And there was already a lot of effort to expand mobile capacity, especially across the southern half of the region. So that's my only thought, is that there were a lot more mobile capacity already in place that maybe didn't need to be augmented because it was already being done. Now, when I say that, mobile capacity means it's not going to be there 5 days a week, 8 hours a day on those 5 days. It's really going to be specific days of a week and a recurring schedule. And there's always room to enhance that, obviously, if that might not prove to be enough for a specific location. So we would have thought there'd still be a desire to have, more face time than not. Because it's a little, as I always say, people with an opioid or a substance use disorder have a very complicated life quite often. And sort of being on a schedule because the van is only there on Tuesdays in the morning is pretty challenging.
Yeah.
It's pretty challenging even with the fixed mortar structures, because people often go as the primary person, but they represent almost a community of people. So there are people with they're called secondary, who they have syringes and needles that they want to have exchanged, but they're not going with the one person. So they may be going for several people.
Okay, so as it stands right now, the RFP issued, and you got 1 response for $50,000. You're evaluating that response now.
Yes.
And I'm sorry, I didn't understand. Did you say you're going to reissue the RFP or?
I believe so. That's the intent, just because it was kind of surprising you got so little.
So there's the potential that 350,000 of it might not be necessary for next year because it won't have, this year's 350,000 won't have been expended yet.
That's correct.
Okay. Thank you.
And then there's a fifth item that the legislature did not use the paragraph that you used about legislative intent for annual renewal, but that the committee is very committed to, and that's contingency management. And just to review with you, that's the treatment for stimulant use disorder, which is the most recent wave of substance use disorder. And it does not have a drug treatment. It has a more reward reinforcement treatment, working with those reward centers in the brain, providing not money, but money in the form of gift cards. So abilities to get reward incentives if one has demonstrated, usually through urinalysis or other means, that they're abstaining from the drug. And it's quite evidence-based and successful. The 800,000 for the last go-around, tremendous portion of it was training the entire state. So all of the treatment providers across the state, and then some. But the program does require additional providers as well as to maintain just the payment structure, which unfortunately other payers will not do, mainly Medicare or Medicaid. So there's sort of a fidelity to what works versus what the payers have paid traditionally, and there's a delta there. So we recommend that be done again.
Oh, I'm sorry.
Go ahead.
For the, was an RFP issued for providers to apply for that, or did one agency across the state receive that entire bundle of 800,000? Because that's an awful lot of incentives.
Yeah.
So was it a
Most of
multitude
it-
of agencies that received some portion of it, or just one agency?
We'll have to get back to you on that one, but I suspect most of it went to us to do the training.
Okay,
So less was done in actual treatment because nobody was trained up to do it. We didn't have a workforce to actually provide it. So
So
that's what
then-
that initial year was for.
Would the same amount then be necessary if the training has already been?
I suspect so, knowing the cost per individual for getting the incentives.
Which is there a estimate on the cost per individual?
More than the $75 that the government will pay. Way more.
Okay,
I
all right, so, and does that happen like, one time with an individual, or do they, they get a gift card and then
over a series,
and then they may get another one? and-
it's over a series of months.
Yeah. Okay,
Not indefinite, but definitely over a series of months.
okay,
And it requires continual revisitation and retesting, participation in the program. Because you get the gift card, but there's more than that. It's obviously you're participating in a treatment.
and,
Constant.
and I don't know if this is so I recognize the reason for gift card, but then I also am wondering, if there's any data that's coming in, and it might be too soon, to be honest, about whether, folks may be exchanging their gift cards for cash.
I doubt there's any data on that at this point.
Right, but is that something it's new, I mean, this was new funding, so we hadn't really done it. We did make the recommendation and, followed through on the recommendation based on the testimony we heard about it being successful.
Yeah,
But there still were questions because it was new.
Of course.
And I'm just thinking about, what's the best way for us to follow up on some of these, newer investments, and how do we ascertain whether we should be making the decision to continue or not, you know?
So one way is we need to build in the responsibility for measurement of outcomes into the grants that we give.
Yeah,
And that is part of the intent and what is done at the DSU level. And it's one thing the governor was very specific about when he was involved with signing the big bill,
Yeah.
obviously,
Yeah.
wanted to make sure we had that built in. So obviously on the way to the real outcomes that we want to see, which of course are things like, decrease in overdose deaths, more people in the treatment system, et cetera. We're going to have to utilize sort of surrogate outcomes or process outcomes. But this is one of them, is like, well, what happens to the money?
right.
Do people actually
They redeem it.
redeem is the word,
Redeem.
redeem their cards, or are they getting money or what?
And I think
Most of these are for actually needs that people have in life, so I'd hope that the cards were useful, and,
Yeah.
satisfied basic human needs.
Right. I mean, I hope so too. I mean, that's the whole purpose.
All right, but you're right. So that's why outcomes are really critical. The only other thing I'll say about contingency management is the success in stimulant use disorder has created a lot of other research, specifically things like alcohol use disorder and other drugs, to see if to see if they're onto something, and that this kind of reward reinforcement kind of protocol can work in other ways. So we shall see.
Well, it's been a decades used method for people with intellectual disabilities over the course of time. So it's actually less favored now, to be perfectly honest, in that realm. But
No, I
who knows?
understand.
It could be something that's really more emerging here.
Yeah, well, I mean, it's, in the end, it's all related to dopamine.
Yeah.
As I'm concerned, and brain neurotransmitters, and are you providing the brain with the same kind of pleasure feelings that the substance that was harming the person was providing?
Yeah. Okay, let's move on to the integration.
Yeah, so now everything else is the new proposals, of which there are 17. And the first grouping, it's not super arbitrary the way we've grouped them, but we tried to group them in ways that had sort of some meaning. So the first one is integration with community life. And I'll ask the chair, do you want me to describe every one of them, or just sort of give you a quick kind of,
Why don't you just give us sort of the quick version?
and then if there's in detail questions, we can.
And then we'll take questions on the sort of group of them.
Okay, good. So in this grouping, there's 7. And the Brattleboro Fire Department is community training programs. So the budget is really providing a lot of staff and oversight and startup costs, things of that sort. But it's really to equip the public with ways to themselves participate in saving lives when you get down to it. The Champlain Housing Trust is building on success from the previous winter with providing services in shelters. And as you might imagine, there's a significant proportion of people who end up in shelters who actually have substance use disorder. And so they're looking for providing more services such as wound care services and sort of medical needs. And so this budget is again for a lot of salary and personnel. The OEO opportunity is really, again, looking at shelters as well, since this is such a prime location, and better serving the needs that people with SUD have in these shelters, especially their medical needs, since they may never see anybody. And this would be their opportunity to actually connect with someone and build some trust.
Would that be, I'm presuming that this is going out to grants to shelter providers and not it's not OEO staff, or is there staffing? Is there some sort of training, or was this
For shelter staff.
for shelter staff? So this will be sub-granted out to shelter staff.
Yes. The HCRS, Project Connection Works, is really I think saving lives directed, if you will, and working with people who are criminally justice involved as well, to engage them in systems they might not otherwise be engaged in. They're trying to work through the whole continuum of prevention through recovery. But again, this is very much, I think, a personnel-related expense, connecting people with trusted people in Wyndham County. And that brings me to a theme that a lot of these projects are very much regional, either municipal or regional. And that's kind of what we want to see. Communities identifying what they seem to think they need and want to implement. And then the goal, of course, of the committee and others will be to see if scaling up needs to occur. If somebody's hit on something like, gee, we should have this everywhere. So some of these, though they're not going to be labeled pilots, are, at least in a municipality or a region, for them, their first effort at doing something. And we need to just look at that and see if they're worthy of scaling further. Pathways for Vermont is a pilot program for contingency management in the DOC served population. And a lot of that budget is transportation budget and training of staff.
So I'm just curious, why there would be a separate appropriations for that as opposed to
Yeah,
not
so
800,000.
So DOC is not a traditional preferred provider, treatment provider. So they're identifying themselves as, we want to do this in our own facility. Whether, you're right, I mean, whether that could come out of the 800,000 is yet to be determined, to be honest.
Yeah.
I should state they're asking for very little money.
I know, I get that, but I'm just
No, this is a question
kind of like
you're
a
asking.
duplication
Yeah.
from my
Yeah.
perspective, that
Yeah.
the 800,000, we don't say that has to go to preferred providers. I mean,
Right.
it can go to any entity that's wants to provide contingency management.
Right, but generally are going to be a treatment provider in a sense. So,
Okay,
but that, you're asking the right questions. It's just hard when.
we're not making any decisions here. We're just making sure we
Yeah.
understand the
Yeah,
information.
no, absolutely. I understand. And the Vermont judiciary is actually pretty novel to really do across the board, across the state training of judges, where there's high variability in their acquaintance with everything we're talking about. And they'd like to reduce that variability and have consistency. And they've got an entire program strategized and planned to do that for a pretty modest amount, actually. And then the last one in this area is the one I foreshadowed when we were talking about outreach workers, and that's VCJR in Chittenden County would like to fund its own outreach worker position because they, again, weren't in the group of people who were identified in the previous 1.976 of getting money. They're pretty new on the scene as well. And they actually came to us and said, if you've got money left over, let's take that. And we said, well, we put all our grants out, and that's the distinction there. So we don't really have extra money to grant out. But the committee was very favorably impressed that they would use the money for a position well. And it seemed like an ideal population to use this in. So that's the bucket of community life, and we can stop there for a second.
We actually probably need to move on. I want to make sure we get through all of these, and then we have some pretty distinct questions about the couple $1 million in the governor's budget around the campus.
Oh, good, okay.
I mean that.
Well, at least it's intrigued you.
Yes, of course, it's intrigued us, you know.
So I'll go through these very fast. Integration with daily activities and needs, and there's 5 of those. Youth services is just, again, focusing on youth in this case, counseling programs, and this is mostly a personnel and training related grant. But it's very focused on youth, as is the next item, which is Friends for Change Youth Center of Bellows Falls. So a very localized approach, looking at intervention, treatment, and harm reduction mainly. Spectrum, probably familiar to everyone here, wants to expand their opportunities to engage with youth in Chittenden and Franklin counties, especially in the screening arena, but also in the connection to services arena, obviously. Prevent Child Abuse Vermont is a pretty novel but established program that actually provided us a lot of information and does a lot of good. And does it mostly in a remote way as opposed to having to be in person, and identified an important need for members of the population with substance use and kids. So hopefully. Higher Ability Vermont should be familiar to everybody here as well. And this is really connecting people to employment services. And the goal here is not only to expand what's going on in Burlington and Newport, where they have a very established footprint, but to expand it to other parts of the state, like Rutland and Bennington. And then on the housing theme, Northeast Kingdom County Action, supporting housing in the Northeast Kingdom. Again, 4 peer support specialists would be the major part of the funding. This is, again, people who can connect people to what they need. And we've already talked about the connection between being unhoused or unstably housed and substance use. Last category, integration with care. So this obviously is much more in the treatment and the medical management kind of angle of things, starting with Connecticut Valley Addiction Services in rural Windsor County, trying to expand what they do for treatment and support in that area with additional programs and personnel. We already have this program called Managed Medical Response Partnership, combination of BCJR and Johnson Health Center, and they need money to continue the work they began last year. Treatment Associates in Washington County is embedding recovery coaches in a treatment program. So that's a pretty novel approach for them. And lastly, Umbrella, which is really looking mostly at domestic and sexual violence. And as you're probably aware, there's a significant connection with substance use and selling of drugs, and getting a workforce to do that and holding them sort of at their mercy. So they want to work with the Kingdom Recovery Center to really better serve those who have that intersection of intimate partner violence and substance use. So that's the proposal. They were pretty novel this time around. I will say that some follow a theme. They don't all follow a theme necessarily, but they look for gaps, mostly because of the lived experience of people in the region that they're looking for.
Well,
One thing I've asked the committee to do this time around is be very, allow flexibility, but be very specific as to, there are some things we actually want proposals on, and here they are. Not again to limit it to that, but to show that, if we have all these experts in the room that are part of the committee, they have opinions about where the system has gaps, where it doesn't have gaps, where we need to short things up, where we need to expand things, where we should be innovative. And it doesn't hurt to let your audience know we're looking for proposals like those. Doesn't mean we don't want to see proposals that you have. It's just trying to really, assess what's going on, because there is so much going on, and it's hard for a community to understand in the big picture what they're doing is either supporting that or totally unique. So.
And I think it's actually nice to see proposals from a wide area of the state, in different regions of the state. And seeing some youth stuff incorporated here, I think is really good. And I do have a question about, and maybe I'll ask that of the committee members, because this is the first time I've seen and this is still relatively new, but first time we've seen proposals from state government.
Yes.
So both rehab, hireability,
Right.
and OEO asking for things that, I don't know how I feel about it, to be honest with you.
Right.
I have questions, but, then again, that's what the purpose of these funds are. And so I just pointing it out for other members, really, gives me a little bit of pause, but.
Right. I mean, like we once thought with tobacco monies, we have monies that these companies are paying because we feel they did an injustice to the nation, our state, what have you.
Yeah.
And why not use that money as opposed to general fund money?
Yeah, I mean.
So,
I get it.
and so that's the dilemma, is well, what bucket should something come out of if something is so worthy that we have to do it? Let's find a way to do it.
Okay, so we have a couple of questions. Both on, if people have to leave, that's okay. Except for we need a quorum, so don't everybody. So we have, there's a lot of confusion, a little bit of confusion. I won't say a lot, a little bit of confusion around this Recovery Campus proposal, and understanding what exactly it is. If it was so important, why wasn't it in the areas to be considered by the opioid settlements fund? Should it be, since we're, I think you can sort of foresee that we're going to be taking some of these things out of here since they're not completely used up this year.
Yeah.
And does it have any connection? Because, our sister committee, Corrections and Institutions, is getting requests for substance use treatment in the community for corrections folks.
Yeah.
And so there's a little bit of confusion really.
I'll give you the perspective and the
Okay.
framework. So, much as I love and respect the committee we're talking about, it doesn't always know everything. So, members of the committee are appointed by the Vermont League of Cities and Towns, and then there are some that are appointed by specific pathways. And it doesn't mean they're all subject matter experts on the whole field. So we do rely a lot on the Division of Substance Use and the department and the agency to really be able to look at our whole system in aggregate. And basically that means, what are we doing in prevention, intervention, treatment, recovery? And where can we do better? Where can we expand? Where do we have nothing? Where are there gaps? So we actually did that. And part of that was because we had some people coming to our door knocking saying, hey, we're involved in these not criminally, but in the justice involved population. And we keep seeing them coming back, sort of recycling, if you will. They go into a treatment facility, and then months later, they're back in front of me again. And then they go back and, et cetera. And so what's going on with that? So we really took a hard look at that. Now, if you know about the treatment system in Vermont, it's mostly hub and spoke, outpatient treatment for opioid use and any substance use disorder. But there is a component of it that is called residential. And I'd estimate that's maybe a quarter of people. And they end up in the hub and spoke eventually, but they start out needing an inpatient level of care. So we came at that going, well, how can we better pave the way for people who need to get into that inpatient system to get there more effectively and efficiently? And then while they're there, the perception was they're not there long enough. And the perception was that's because Medicaid wouldn't pay them. Turns out that's an incorrect perception. But the reality is perhaps they could benefit from longer stay where they are, maybe not at the highest level of medically managed withdrawal care, because that doesn't last very long, but at a lower level of care where they got the appropriate medication as well as counseling individually and in groups, et cetera. And then the second thing we said is maybe it's the transitions that are the problem. People are falling through the cracks, especially vulnerable people. So if you leave residential, you've got to have somewhere to go. You don't just sort of say, well, I've been through my month of residential treatment, so opioids are in my past and the future is bright and I'm out there and I live in my life. Well, it never happens that way because it's a chronic condition subject to relapse. People need a lot of support early on and they need a life to live. They need housing, they need employment supports, et cetera. So we worked on where are the transitions. So one transition is getting in. The other transition is as you exit. So part of the proposal is called recovery navigators, which are employed by the residential facilities and will help people get to where they need to get to. Now, if you're in a residential facility and you require that level of care, we would submit that you need probably more time in some system of care. And you can't just sort of go back to where you came from. In fact, that could be the most dangerous thing that happens to you. So going to a lower level of care within the residential system is one pathway. Going directly to a recovery bed, so-called sober housing, recovery housing, label it as you would like, is another ideal way to go. Now, when you go to a recovery bed, you can take your medication for opioid use disorder, but you cannot take medications you used to take that were opioids that you were abusing. Unfortunately, because people are new in their recovery, there's a portion of people who will relapse right then and there and have to leave recovery housing. They have to have somewhere to go. The place to go is to what we call a re-engagement bed or a stabilization bed. And so establishing those is part of this bigger governor proposal as well. In addition, if you are...
Last year, though.
Yes. We'll get there.
Okay, all right. I'm
so-
trying to connect the pieces
Yeah.
of this
The
puzzle.
other person who needs the stabilization bed is people who are still in residential, but there is no recovery bed. Because I said there's 112 or whatever out there, and there may be a wait to get into a recovery bed. They need a place to stay stable as well. So that increases that population. Then you have to ask, what happens when you get to your recovery bed? So the goal of a recovery campus is to actually have, and currently, all of the work you need to do in recovery, which usually means outpatient treatment or intensive outpatient treatment, meaning transportation to that treatment and adherence to that whole treatment program. And you need the other life supports. How do you actually live your life in a productive way? Higher ability playing a role here, connection to employment opportunities, to workforce training, et cetera. The whole issue of once you leave your recovery bed, do you actually have a place to live? And no, we don't want you going back to live with the friends you lived with before you got sober, because that's not a conducive place to your staying in remission, you need to have a better place to that to go. And these things don't happen overnight for anybody, and they take time. So having the opportunity to spend weeks to months on a recovery campus where you're getting your treatment and the transportation you need, you're getting the recovery support services you need because they're present on the campus is really critical. And so it's visualized as a 15-bed community, if you will. Similar in some ways, but unique in some ways to something like a Jenna's Promise, which obviously has its own specific population that can go there. So that's the, I guess in a nutshell, trying to give you what you asked for.
Okay, and so is the intent that there would be an RFP issued to secure a
Yes.
provider for this?
It's already been RFI issued,
Okay,
and got some interest there, and then the next step would be an RFP issue.
any of these services Medicaid eligible?
The answer is yes, and I'm not going to be the expert witness to give you
There's the 1.5,
the medical management part, like going to your IOP
yeah,
or to your whatever outpatient
right,
is certainly going to be. But a lot of the other things currently are not.
yeah, I'm just
There-
thinking about the milieu that would happen
Yes,
at the campus, not the sort of medical
right.
that would go out and they would be billing Medicaid separately. I'm just meaning
Right.
of this 1.5 million that's in there, is any of that matchable with global commitment?
So I'm going to let you ask the secretary when she comes to testify, because I don't have that today.
Okay,
She's coming this week.
not here,
Oh, no?
no,
Oh, maybe to the Senate, sorry.
okay. Yeah, I think
But we'll get an answer to that.
okay, all right, that, it would be helpful. We're trying to make our recommendations and we're trying to figure out, where's the best source. So then my other question.
My knowledge is it's not currently matchable, but
But might,
maybe
in the
in
future.
the future because of waiver issues. that-
okay. So two questions. We've been in meetings with a federal judge and all the folks around that. Does this help to solve that piece of the system that we all had identified as being missing in Vermont? So where you needed extended lower level treatment beyond residential treatment.
So the monies that are being asked for in this budget proposal are not. But the reason is because there is some money that's already available. You mentioned the stabilization bed money. There's also within the system, the Serenity House in Rutland has already opened. It has several lower level beds, meaning not the highest medically managed withdrawal beds, but lower level for people in a residential setting to get the services they need. It additionally opened, I believe, 16 more beds that are now open and are getting filled to provide for that need. So that's sort of, if you will, the pilot in this direction.
Okay.
And the goal would be to interest the other treatment providers in doing similar.
And how are those funded?
So those have a Medicaid
They
rate.
have regular Medicaid rate
Yes.
and go with that. Okay, all right. And then the second question is, so this doesn't really address that, but are you saying it's addressed in other?
It's being
ways?
addressed as part of what we call the continuum of care.
Okay.
It just doesn't require a new budget.
Okay. The second question is, was there any discussion about this proposal at the opioid settlement abatement special committee?
No, and that's a matter of timing, because all of our decision-making had to be made literally around Christmas. And the governor's formal declaration of what our proposals were late enough in the season that the committee had nothing to work with.
But you start the budget process like in September and October.
Understood. There were a lot of pressures this year in terms of housing and education, and this is part of, intentionally part of our public safety proposals from the administration because of the highest focus on justice involved population in the state.
Okay, so then the link, if there is one, to what is happening, there's a request. I'm not sure who it's by, if it's by Pathways or not, to be honest. There's a request for substance use treatment downstairs in corrections and institutions. And I was hoping that the vice chair was going to be here, but he wasn't here to ask that question. Are you familiar with that at all?
Peripherally.
Okay. But it doesn't have anything to do with anything you've presented here today.
No.
Okay.
Because in corrections, they're talking about actually a treatment campus in corrections.
Yes, so this does not have anything to do with.
This does not have anything to do. No.
And I'm not sure the proposal that's being presented to them by community providers has anything to do with the treatment campus either, but.
Okay.
But what we're trying to discern is there overlap? Is there part of that was within part of, this? And I'm hearing you say, no, it's not. Okay. So while we're on corrections, where did it go? It says recovery centers here, but I'm not sure it was going to recovery centers, but there was 1.06 million that was going out for, essentially, the same kind of folks that you're talking
Recovery
about.
coaches.
Recovery coaches.
Recovery coaches.
Yeah,
Yes.
specifically targeted towards people leaving corrections.
Yes.
And
To provide continuities, because they'd
Right.
actually be connected with them in the correctional setting, and they would be their contact as they exited to the community.
okay, and I see that I don't know, it doesn't look like they reapplied for funding. They weren't continued in this year's funding request for the opioid. And from here, it doesn't look like any of the money's gone out the door yet. So it wouldn't necessarily need to, but, okay. So I think we still need to discern whether or not what is being asked for downstairs has any connection with that 1.06 that was funded out of the 25 budget. I'm gonna look to my, BDH people to see if we've gotten all the answers that you need.
I'm gonna go strong, yes.
You're gonna go strong, yes.
Strong, yes.
And you've properly discerned the strong connection with recovery. It's just different, with corrections, but it's different money. Because a lot of what is happening with corrections is people entering our systems that we're talking about here and making sure that through the trial system and others that there is pretrial supervision, et cetera, and allow people to get to treatment rather than be incarcerated. But then the second part is, while incarcerated, have a robust recovery peer workforce. And then the third part is actually making sure that when they exit corrections, things go well, and there's a lot of connections to what people need.
I want to come back to the 1.5 just for a quick minute. And you talked about recovery navigators for the residential service providers. I have to say, I'm a little bewildered by that. I would think that there would be appropriate information and referral, case management follow along from residential treatment to, sort of your next step,
Right.
and this seems like, why would we then have to fund that as something separate?
I think it's building on the fact that people are falling through the cracks.
Mm-hmm.
I'm not blaming what's going on in the residential system. It could be the individuals who allow themselves to fall through the cracks or what have you, but they are falling through the cracks. There's enough lack of true continuity. So people may have literally nowhere to go, but are ready to be discharged. And I think this will ensure they go to the right place.
Mm-hmm.
Even if the right place is a re-engagement bed, that's a supervised re-engagement bed where they're safe and they're not subject to the influences that are going to be bad to sabotage all the treatment that they got. So I hear what you're saying. I think I don't have data, and I'm not here to advocate for BCJR,
Mm-hmm.
but they kind of do that on a very one-on-one scale.
Mm-hmm.
They've identified people who have been newly released from corrections, and try to do what they need. To the point where they're driving people to, appointments they need because of DCF and
Yeah.
DIVA and what have you,
Yeah.
as well as to treatment and all of that. So
Yeah.
this is to get to that kind of, I think, more personalized approach to caring for these people so they actually have the best chance to succeed. And it's not going to fail because they fell through the cracks in the system.
And the 500,000 that's in one time in the 1100s, that's for potential fit up modifications, whatever, to this campus?
In the 1100s.
One time requests. There's 500,000 in one time.
Yes,
Is that related to this campus?
that is. It's
Okay.
500,000 one time and 1.5 million
Ongoing.
ongoing.
Yeah. And the 500,000, I guess I'm trying to figure out the one time is that for
It's establishment, capital, things like that.
capital things? Okay.
Refitting a pre-existing campus as it would be needed.
And are you looking at these, so that's one time. Are you looking at the 1.5 as being,
Maintaining the services.
Right, is that a full year's worth, and are you expected to have that running by July 1?
One, I can't answer that.
Okay, seems unlikely.
Yeah, no, well, knowing when money actually
Right,
happens,
right,
I would feel comfortable saying July 1 would be early.
yeah, yeah,
But if one of if the campus was actually in a campus that already existed, it will not require the work that a new campus.
right, right,
And indeed, we do know of places where that could happen.
could happen, okay. All right, any other quick questions from committee members? Yeah, go ahead, Eric.
Yeah, just quick, the Aftercare Navigators, was that a request made by the residential treatment providers or something that your office identified?
We identified that.
Okay.
They were very happy to hear that, but I don't think it came from.
Thank you so much for answering all these questions and for getting back to us as on the stuff that's sort of in that middle section about unspent obligations. Be helpful to know anticipated
I appreciate that.
amounts there.
And we have some stuff we'll have to get back to you on, as we say.
Yeah, thank you so much.
Can I keep this?
You absolutely can. And electronic version of it that has the color coding is on our website.
Yeah.
Yeah. All righty. Thanks, everybody. Thank you for